Welcome to Maine's Before the First Tooth virtual training, a prenatal and infant oral health prevention initiative. This initiative aims to improve the oral health of pregnant women and infants through education, collaboration, and the integration of oral health into prenatal and primary care. I'm Rachel King, pediatric dentist and consultant with Before the First Tooth Initiative. Oral health care is an integral component to a woman's prenatal care during her pregnancy. While providing oral health care to a pregnant woman is important, educating them about prevention and treatment of dental caries and other oral diseases is essential for the overall health of the woman and her baby. This training will provide you with basic oral health education, reasons why preventive oral health is important, and key messages for you to engage in conversation with your clients or patients. Handouts that can be shared with families will be highlighted throughout the video. In addition, an accompanying handheld flipbook is available that may be used when talking with families to help guide your discussion. All of these materials can be found on our website, www.fromthefirsttooth.org, under Resources. This initiative will engage with trusted community organizations to disseminate key education and messages to pregnant women. The initiative is also working with select medical practices providing perinatal services to test changes and improve processes in their clinical settings to increase access to dental care for women and children most in need. This training will cover the following objectives. We will review basic concepts regarding oral health in pregnant women, infants, and children. I will identify appropriate oral health messages for pregnant women, infants, and children. Finally, I will discuss the importance of the dental home and providing referrals to dentists. As stated by the World Health Organization, oral health is the state of being free from chronic mouth and facial pain, oral and throat cancer, oral sores, birth defects such as cleft lip and palate, periodontal or gum disease, tooth decay and tooth loss, and other diseases and disorders that affect the oral cavity. Oral health is an important component to overall health and a key aspect to wellness. Although many only think of teeth when thinking about oral health, as this definition from the World Health Organization indicates, oral health is so much more. Understanding the broad impact of oral health on quality of life, especially for pregnant women, infants, and children, is essential to providing these groups with the best possible services. There are many factors that influence oral health. Reviewing this list, with the exception of fluoridated water, you can see that these factors are the same factors that impact many other areas of health. Everyone has had the experience of a nurse or physician describing the impact of diet and behavior on cardiac health, obesity, risk for diabetes, and general well-being. Therefore, efforts to improve oral health will contribute to overall health and are likely a part of the conversations you are already having with clients. The types of food a person eats and the frequency and type of oral hygiene practices can have a great deal of impact on the development of oral disease. Behavioral factors such as alcohol, tobacco, and substance abuse can also play a role. Tobacco use can cause staining to the teeth, affect the condition of the gums, and as with alcohol, can increase the risk for developing oral cancers. Alcoholic beverages may increase the frequency of exposure to acid and sugar in the mouth, and illicit drug use, such as methamphetamine, can increase the risk for tooth decay and impact the immune system. Certain medical conditions, such as diabetes and even pregnancy, can cause changes in the mouth that may be detrimental to health. Access to care is an important aspect of maintaining quality health. However, distance, location, finances, language, and culture can all impact whether one is able to obtain dental care. This is why access to fluoridated water is key. Fluoride provides the benefit of strengthening teeth. Similar factors that impact oral health can influence our overall health. Poor dental health can impact the other areas of the body. Bacteria that cause tooth decay and gum disease can enter the blood through a large cavity in the tooth or very inflamed gums, traveling to other parts of the body. Heart infections are possible, as well as respiratory infections, especially in the elderly. Diabetes and periodontal disease, which is bone loss around the teeth in addition to gum disease, have been linked with the control of one disease improving the state of the other. Keeping the mouth clean and dental disease under control can reduce the incidence of the systemic complications. Tooth decay, or cavities, occur when bacteria in the mouth consume carbohydrates and sugars, developing an acidic environment within the mouth. This acid leads to the breakdown of tooth structure, and when enough tooth structure becomes involved, bacteria can enter the bloodstream through the pulp or nerve of the tooth. Gum disease is another bacteria-driven oral disease, where bacteria in the mouth builds up on the teeth and around the gums. This is called plaque. Plaque can irritate gum tissue and cause the gums to become swollen and inflamed, allowing another access point for bacteria. Here are a few examples of various dental conditions, including dental caries and gingival and periodontal disease. The point of these pictures is not for you all to become dentists able to diagnose and treat, but rather to recognize when something's not right. In conversations with moms or interactions with kids, you often pick up on some differences in the mouth. Noticing stains, brown spots, broken down teeth, or poor oral hygiene should spur you to start a conversation regarding oral health practices of the family. One tool that has proven to be successful in reducing the occurrence of dental disease is fluoride, a naturally occurring ion that strengthens teeth, making them more resistant to tooth decay. Fluoride, added to community drinking water at recommended levels, has been shown to be a safe, inexpensive, and effective method for prevention. Community water fluoridation provides benefits for everyone in the community, regardless of age or socioeconomic status, and thus it provides protection against tooth decay in populations with limited access to other preventive services. Those not served by community water supplies should consider having their well water tested to determine if they are receiving optimal levels of fluoride or if some form of supplementation might be needed. Why are we so worried about dental disease when we live in a country like the United States, where we have advanced technology and well-trained practitioners? It's because dental disease is still a big problem in our country, despite advances in medicine. 25% of Americans have at least one untreated cavity. This means that 1 in 4 people is regularly experiencing pain, sensitivity, or may be at risk for more serious infection. 80% of Americans have had at least one cavity by the age of 17. If 80% of children developed diabetes by their 18th birthday, the country would be in a panic. However, dental decay is a disease and should be taken just as seriously. It is the most common chronic infectious disease of childhood, 5 times more common than asthma, and 7 times more common than hay fever. These are concerning numbers since dental disease is preventable. While you are working with pregnant women, it is important to understand the oral changes that occur during pregnancy. Brushing can become more painful due to pregnancy-related gingivitis, but should not be avoided. Additionally, morning sickness, nausea, and acid reflux may lead to increased acid in the mouth, or frequent snacking on carbohydrates like saltines to settle the stomach. Visiting a dentist during this time is important to identify different types of disease that may need treatment, reduce bacteria in the mouth, and implement strategies for keeping teeth and gums healthy. Please educate the women you are working with that it is both safe and recommended for women to see the dentist during pregnancy. Preventive, diagnostic, and restorative dental treatment is safe and recommended throughout pregnancy. Most dental pain medications are safe, with the exception of non-steroidal anti-inflammatories at certain points. A woman should consult with her physician regarding self-medication. Local anesthesia and most of the antibiotics used in dentistry can be safely administered to pregnant women as well. X-rays are also considered safe and necessary for diagnosing many infections and complications. Dentists will recommend X-rays if needed and will use lead shields to cover the stomach and thyroid, and the radiation exposure is minimal. The Organization of Obstetricians and Gynecologists have stated cleanings, extractions, root canals, and restoration of untreated caries may be managed at any time during the pregnancy. Delaying treatment may result in more complex health problems. There are two great professional documents that act as guides for both medical and dental providers about the importance and safety of oral health care during pregnancy. First, the committee opinion referenced previously, and second, the National Consensus Statement, which was developed by the American College of Obstetrics and Gynecology and the American Dental Association. The purpose is to help health professionals improve the delivery of oral health care services during pregnancy, bring about changes in the healthcare delivery system, and improve the overall standard of care. When speaking to pregnant women, it is important to relay consistent messages. First, there are changes in the mouth that occur during pregnancy, and pregnant women should be taking good care of their oral health for both themselves and their babies. Brushing and flossing regularly will help reduce the severity of pregnancy gingivitis and reduce the amount of bacteria present in the mouth, which will decrease chances of passing it to baby. Second, it is safe and recommended to see your dentist for regularly scheduled visits. Additionally, little tips to maintaining strong teeth and healthy gums can be provided, such as, if a pregnant woman vomits, the acid can damage her teeth. While the first instinct is to brush immediately, it is actually advised to initially rinse with water or a baking soda water rinse, then wait 30 minutes to brush. Brushing immediately can lead to scrubbing away healthy enamel. A baby's teeth begin to form very early in pregnancy, so for healthy teeth in baby, choosing foods such as raw vegetables, fruits, yogurts, and cheese will promote healthy development, as will taking prenatal vitamins. It's important to share with women that baby teeth start forming during pregnancy. Also, permanent teeth are forming even before the first tooth erupts. Before the First Tooth has developed numerous resources to utilize in educating pregnant women about oral care. Please consider making these materials available to families. The above postcard reinforces some key points to address with pregnant women related to optimal oral health. 1. Schedule a dental visit during pregnancy. 2. Discuss concerns such as bleeding or swollen gums with your provider. 3. Continue to brush and floss regularly. 4. Drink fluoridated water to prevent tooth decay. Once mom has been educated on how to take care of her own oral health, it is time to provide some information about steps to take with baby. Even before the first tooth erupts, the baby's mouth should be wiped with a soft cloth after feeding. Keeping the mouth clean also means keeping away the bacteria. Moms can pass cavity-causing bacteria to babies by sharing utensils, using their mouth to clean a dropped pacifier, and even blowing on food. If a mom had a cold or the flu, she wouldn't do any of these things. So it's important to convey that tooth decay is an infectious disease too, and the same steps can be taken to prevent sharing germs. In addition to hygiene, diet is important even in the littlest children. Bottles with sweetened drinks should be avoided, especially at bedtime or nap time. When we sleep, our mouths have less saliva to wash away the sugars and bacteria, increasing risk for developing decay. Once teeth do erupt, brushing should begin, even if it's just one tooth. A small amount of fluoride toothpaste, the size of a rice grain, should be used twice daily to brush baby's teeth until the age of 2. This small amount will benefit tooth development and will not cause problems if accidentally swallowed. A fluoride application from a provider may also be recommended depending on risk for developing tooth decay. As with babies, avoid sweet beverages. The sippy cup should only have water, and milk or juice should be limited to mealtimes only. Babies should have their first dental visit by 12 months of age in order to establish a dental home, receive appropriate preventive education, and identify potential problems early. Remember, first dental check should happen by the first birthday. As children get older, routine dental visits should continue, as well as twice daily brushing. A pea-sized amount of fluoridated toothpaste should be used starting at age 3. Juice should continue to be limited as it contains lots of sugars. Fluoride treatment may be recommended by the pediatrician. As toddlers get bigger, they may become more independent and want to brush their own teeth. However, their dexterity hasn't adequately developed yet to do a good job. They don't have a strong understanding about the reason for brushing, so parents should continue to brush their teeth until 7 or 8 years old, or about the time a child learns to tie his or her own shoes. Continue using fluoride toothpaste for twice daily brushing and seeing the dentist for regular checks. As teeth begin to touch, flossing is indicated since the toothbrush can't clean in those tight spaces. Encourage water, limiting sugary drinks. Fluoride applications may be recommended, and in areas where the water is not fluoridated, a child may be prescribed a fluoride supplement if the dentist or physician feels it is appropriate. Handouts can serve as helpful reminders for pregnant women regarding the key points of oral health for their babies. These include 1. Fluoride is important for all ages. Women should discuss annual fluoride varnish applications for children with their doctors or dentist, and those with well water should consider having fluoride levels checked. 2. The initial dental visit should occur by baby's first birthday, and then at regular intervals as advised by the dentist. 3. Mom should not share spoons, cups, or toothbrushes with baby to avoid transfer of cavity-causing bacteria. 4. Brush infants and toddlers' teeth twice a day with a smear of fluoride toothpaste. 5. Limit juice drinks to mealtimes, using sippy cups or travel cups for water only. With pregnant mothers and at each stage of development, a common theme is regular dental checks. Having a dental home provides continuous prevention education, a resource to answer questions, and point of contact in the event of an emergency. The relationship developed early on between a child and his or her dentist will also create an environment of trust and set the child up for lifelong oral health and positive dental experiences. Before the first tooth and from the first tooth can provide educational materials for pregnant women, caregivers, and children. For information and resources, visit our website. Please feel free to reach out to us should you have any questions about how to provide education to your clients. As you begin discussing good oral health habits with families, please use your handheld flipbook to guide your discussion. The educational materials that were highlighted throughout this video can be found at our website, www.fromthefirsttooth.org, under Resources. For additional resources to learn about oral health and materials to use with clients, please visit these websites. This concludes our training today. Here are the key messages we hope you take away. Visiting a dentist during pregnancy is safe and important to identify different types of disease that may need treatment, reduce bacteria in the mouth, and implement strategies for keeping teeth and gums healthy. Brushing and flossing regularly will help reduce the severity of pregnancy gingivitis and reduce the amount of bacteria present, which will decrease chances of passing it to baby. Educate women you are working with that it is both safe and recommended to see the dentist during pregnancy. Thank you for participating in this training. We appreciate your role in keeping all Maine families healthy throughout the life cycle.